Modern dental x-rays, particularly our digital dental x-ray technology, is exceedingly safe. Most dental practices now utilize digital x-ray technology. It's probably been some time since you've been in a dental office where they've used a literal piece of film that they had to develop. Now we utilize technology that allows us to place a sensor into your mouth. This small plastic sensor is not too dissimilar from sensors that are on the inside of our iPhones or digital cameras that basically convert electromagnetic radiation into a signal that your computer can understand and turn into an image. The benefits to this are a couple of very important things. For the diagnostic capability in the dentist and the dental team's hands, this allows us to generate images with a resolution that would be unheard of using conventional film. And much like modern cameras can zoom incredible distances at clarities that would be impossible with traditional film, our dental x-ray technology allows us to see changes in density in your tooth that can correspond to things like cavities or losses in bone around teeth in a way that we never could before. One of the questions that I get from a lot of older patients is if they come from another office and they come to our practice and they say, gosh, I for years didn't have problems and now I have cavities at a rate that I never did. Sometimes that can be attributable to new x-ray technology. We can see things now that may have been dormant or slowly progressing that would not be evident in classic film technology for years. If we can see something when it's small and we can stop it early, we can do a procedure that's significantly easier, a lot of times cheaper, and more predictable in terms of creating healthy spaces in your mouth. The x-ray technology is amazing at allowing us to see things that we never could before. And just like something like Photoshop on your computer or filters on your Instagram, we can apply filters to our x-rays on the computer that allow us to boost and see things that would just be impossible with the naked eye or on the screen. It's interesting, when you're trained to look at x-rays, the longer that you do that, you start to understand that you're not actually seeing the tooth, and that's a weird distinction to make. You're not actually looking at the bone, you're seeing clues about what's happening. So sometimes a cavity is super obvious on an x-ray and I can put it up on a screen and show a patient and say, that right there is a cavity, and they say, I see that black spot or that hole. Other times we're noticing subtle changes in the pixels on the computer screen, shades of gray that are changing in areas that maybe they shouldn't be. The other thing that's important to understand is that modern digital dental x-rays, we only have to emit a fraction of the radiation that we used to have to do. The new dental sensors that we use are highly sensitive, and sometimes our modern dental x-rays are about 1/10 the radiation exposure of some of the old film systems. In most of our offices, patients receive a series of x-rays, usually once a year. This can be anywhere from 4 x-rays to 20, 25 x-rays, depending on your needs. Some insurances require additional x-rays in order to authorize payment on certain procedures. But the important thing for you to understand is just how low the total dose is of even a few dozen dental x-rays. When we're talking about exposure to radiation, we make those assessments with a unit called millirem. The average person in the United States is exposed to about 600 or 650 millirems of radiation a year. And most of these millirem exposures have to do with background sources of radiation. The sun creates some background source. There's radon gas that's naturally emitted from rocks, concretes, even things like granite or stone countertops in our home emit small amounts of radiation. To give you an example, if you live in a brick house, for instance, you're exposed to around 7 millirems of radiation a year more than if you lived in a house made of something like siding. And that's because the stones, the clays used in fabrication of bricks have small amounts of radioactive isotopes in them that actually emit small amounts of radiation into your home and out of your home. So to put that in perspective, a dental x-ray today in a digital office is emitting about 0.1 millirem radiation per x-ray. And so that means that living in a brick house is the equivalent of about 70 dental x-rays a year. On a flight from New York to LA, you're going to be exposed to the equivalent of about 50 or 60 dental x-rays, and that's just from sitting in the airplane. And there's some interesting, funny ways that we assess radiation exposure, including kind of a little inside joke, but there's a naturally occurring radioactive isotope of potassium that all bananas have a little bit of. And we can use the amount of radiation in a banana to make comparisons to other things in life. And we call this a banana equivalent dose. Now, this is not a real assessment of radiation exposure, but it's a cute way to understand just how much radiation there is naturally occurring. And it also can help you understand just how little exposure you're getting at the dental office. So one dental x-ray is generally the equivalent of about 30 bananas radiation. And so I always tell patients that just to set their mind at ease. If you have concerns about radiation exposure due to x-rays in the dental office, have a discussion with your dentist or your dental team. Some patients who are at low risk of cavities, who do a very good job at home, they may elect and be able to change the frequency of their x-rays. Other patients, you might want to consider increasing the frequency of x-rays depending on needs and conditions in the mouth. The technology that we're using and the scale of radiation that we have to use to capture a dental x-ray is exceedingly low and super safe for you and your family.